Today I'm going to talk about schizophrenia and how certain vitamins, minerals and herbs may be beneficial. Magnesium. Patients with schizophrenia have lower erythrocyte magnesium levels than controls. Magnesium plays a major role in calming the nervous system due to its ability to block brain N-metal D-aspartate receptors, the NMDA receptors, thereby inhibiting excitatory neurotransmission. Magnesium bisglycinate is my recommended source for its high bioavailability and its low stomach upset. The best way to determine your magnesium needs is to start with a small dose 3 times a day, then slowly increase this until side effects such as stomach upset or diarrhea is noticed. Once this occurs, slowly reduce your dose until you're taking the maximum daily amount that doesn't give you any stomach discomfort. This protocol can also be used to determine your dose of vitamin C when taking ascorbic acid, which is also useful for schizophrenia. However, there's better forms of vitamin C, so instead of ascorbic acid, use calcium ascorbate or magnesium ascorbate, or even liposomal vitamin C or intravenous vitamin C. These, as they're non-acidic, can be taken in much higher doses. In one trial, vitamin C reduced hallucinations, suspiciousness, and disorganized thoughts. Up to 6 grams daily of vitamin C have been reported to be beneficial for people with schizophrenia. In one case, an addition of 400 international units of vitamin E enhanced the benefit. Inositol is a carbohydrate that's found naturally in your body and in certain foods. It plays many roles in your body, including affecting levels of neurotransmitters and the way your body handles glucose. It may be effective in improving some anxiety disorders and your body's sensitivity to insulin. Inositol is a key metabolite in the phosphodiethyl inositol cycle, which is a secondary messenger system for serotonin receptors that have been implicated in the pathophysiology of schizophrenia. Evidence from animal and human studies have linked myoinositol with the pathophysiology and the treatment of psychiatric disorders such as schizophrenia and bipolar disorder. Most side effects only occur when doses of greater than 12 grams per day are consumed. There's good rationale for taurine being beneficial in schizophrenia and psychosis. It's an amino acid that's abundant in the body. It's neuroprotective against the damage in neural cells caused by abnormal glutamate signaling, which is heavily implicated in psychosis and schizophrenia. A clinical trial conducted in Melbourne in 121 young patients with psychosis found that 4 grams of taurine per day reduced psychotic symptoms within just 12 weeks. Theanine, which is extracted from green tea. Essentially, L-theanine crosses the blood-brain barrier, and it has the ability to modulate inhibitory neurotransmitters, selective serotonin and dopamine, to bring about anxiolytic and calming effects. L-theanine can also improve cognition and selective attention, perhaps due to changes in alpha brainwave activity. Effective doses range from 200 to 800 milligrams per day. Preliminary findings suggest that L-theanine may be an effective adjuvant in the treatment of psychotic disorders. Patients with schizophrenia or schizoaffective disorder were randomized to receive L-theanine or placebo while continuing their antipsychotic medications. 21 patients who received L-theanine experienced moderate reductions in symptoms of psychosis and anxiety, and there was no difference in quality of life measures between the groups. GABA, or gamma-aminobutyric acid. GABA dysfunction is thought to lead to the disinhibition of glutaminergic pyramidal neurons and a loss of synchronous cortical activity. Post-mortem studies also suggest that schizophrenia is associated with dysfunctional GABA signaling at the postsynaptic receptor level. There is speculation as to the availability of GABA supplements, as there are GABA receptors in the stomach. However, GABA as a supplement may be unable to cross the blood-brain barrier. There are, however, many other substances that do cross the blood-brain barrier and increase GABA in the brain, such as passion flower, L-theanine, and picamilin. According to some scientists, the use of picamilin in the treatment of neurosis, manic depressive syndrome, and schizophrenia enables lower doses of psychotropic drugs to be prescribed. So combining picamilin with conventional treatments reduces psychopathological symptoms faster than the conventional treatments alone. Picamilin is a chemical mixture of GABA and niacin, which I'll talk about later. 5-HTP. Serotonin can affect sleep, appetite, temperature, sexual behavior, and pain sensation. Since 5-HTP increases the synthesis of serotonin, it's used for several diseases where serotonin is believed to play an important role, including depression, insomnia, obesity, and many other conditions. Research suggests schizophrenia may be caused by a change in the level 2 neurotransmitters, dopamine and serotonin. Some studies indicate an imbalance between the two may be the basis of the problem. Others found a change in the body's sensitivity to the neurotransmitters to be part of the cause of schizophrenia. Early research suggests taking 800 milligrams to 6 grams per day of 5-HTP in combination with carbidopa for 3 months might improve schizophrenia symptoms in some young men. Acute thiamine deficiency leads to Wernicke's encephalopathy. Patients diagnosed with schizophrenia are at risk to develop Wernicke's encephalopathy. Timely treatment with high doses of thiamine can adequately treat this. There's one interesting case where a report of a 63-year-old woman with thiamine deficiency who showed auditory hallucinations, a delusion of persecution, a catatonic stupor, and catalepsy. She had her thiamine concentration measured and it was 19 nanograms per mil, which is only slightly less than the reference range of 20 to 50 nanograms per mil. Her psychosis was unresponsive to antipsychotics or electroconvulsive therapy, but it was ameliorated by repetitive intravenous thiamine administration at 100 to 200 milligrams per day. However, 1 month after completing the intravenous treatment, her psychosis reoccurred, even though she was given 150 milligrams of thiamine per day orally, and her blood concentrations of thiamine was maintained at the far high range of the reference scale. Again, intravenous thiamine administration was necessary to ameliorate her symptoms. The present patient indicates that the possibility of thiamine deficiency should be considered in cases of psychosis without neurological disturbance and high-intensity T2 MRI lesions. Also, the case suggests that a high blood thiamine concentration does not necessarily correspond to sufficient thiamine levels in the brain. Based on this, it should be considered that the importance of a high dose of thiamine should be administered as a therapy for thiamine deficiency to schizophrenics. Some research suggests a link between low vitamin D levels and a person's risk of developing schizophrenia. A 25-hydroxy vitamin D blood test can assess levels, and then a supplemental dose can be calculated to correct this deficiency. CDP choline. Choline can be found in eggs, however, there are many better supplemental forms. you can see my other video on choline sources for nootropics to learn about them. Improvements in inhibitory neural functions whose deficit is associated with schizophrenia and attention deficit disorder have been observed with choline supplementation. CDP choline is bioavailable form of choline. Do not use the cheap form of choline, such as choline bitartrate. Research also suggests that choline supplementation during pregnancy may help prevent a baby from developing schizophrenia later in life. The importance of omega-3 fatty acids for physical health is now well recognized, and there's increasing evidence that omega-3 fatty acids may also be important to mental health. Omega-3 supplementation is more effective in reducing psychotic symptom severity in young adults or adolescents in the prodromal phase of schizophrenia who have lower omega-3 baseline. Omega-3 supplementation was more effective in patients with low polyunsaturated fatty acid baseline. Doses of omega-3 fish oil, which contain an EPA-DHA blend, can be from 3 to 9 grams per day. A study on 644 bedridden psychotics reported that 78% of schizophrenic patients had vitamin B12 deficiency. Some studies have clearly indicated the contribution of folic acid, vitamin B12, and homocysteine to altered single carbon metabolism and its role in the psychopathophysiology of schizophrenia. Methylcobalamin is the best oral form of B12. B12 injections would be even better. Note, due to food fortification with folic acid, B12 blood tests are not reliable for detecting a B12 deficiency. TMG, trimetal glycine or betaine. Many psychiatric drugs act on the receptors or transporters of certain neurotransmitters in the brain. However, there's a great need for alternatives, and research is looking at other ways to target the brain's metabolic pathways. Lack of glycine, betaine, contributes to brain pathology in schizophrenia, and new research shows that betaine supplementation can counteract psychiatric symptoms in mice. Betaine, or trimethylglycine, is now extracted from sugar beet. It's a powerful metal donor with numerous benefits attributed to its use. Psychedelic drugs like PCP and methamphetamine can also produce schizophrenia-like behaviors in both humans and mice. So researchers tested whether betaine supplementation could help alleviate symptoms induced by PCP and methamphetamine in the mice. They found that betaine not only improved cognitive deficits and behavioral abnormalities, it also reversed oxidative stress at the molecular level. Oxidative stress is thought to be one mechanism through which these drugs cause psychiatric symptoms in humans. Investigation of post-mortem human brain samples also showed reduced betaine levels in patients with schizophrenia, and this was unrelated to the amount of antipsychotic drugs taken before their death. They also found a subset of brains with betaine deficit oxidative stress, which is a pathology that occurred in cases with severe psychotic symptoms. The researchers were able to replicate this pathology in induced pluripotent stem cells that simulate the oxidative stress condition and then counteract it with the betaine supplementation treatment. Along with Dr. John Smythes, Humphrey Osmond developed the theory that schizophrenics suffer due to endogenous production of adrenaline-based hallucinogen. This led to the Hoffer-Osmond adrenochrome hypothesis in the early 1950s. Humphrey Osmond and Abram Hoffer, their primary orthomolecular approach to schizophrenia is with niacin or niacinamide in doses greater than 2 grams per day. In double-blind trials, 3 grams of niacin daily resulted in doubling in the recovery rate and a 50% reduction in hospitalization. There are several complexities to niacin therapy. It must be at least 3 grams per day in divided doses. It must not be in the time-release form made by pharmaceutical companies, as these are dangerous and they're the root cause of the irrational fear of using high-dose niacin. It's most effective if the patient's schizophrenia is fairly recent development. Ignoring these issues is probably why some of the studies resulted in negative results. Nobel Prize winner Linus Pauling wrote in 1967, "I happened to read a number of papers published by 2 psychiatrists in Saskatchewan, Canada, Dr. Abram Hoffer and Dr. Humphrey Osmond. There was something extraordinary about their work. They were giving very large amounts of niacin to the schizophrenic patients, as much as 17 grams per day, which is 1,000 times the recommended daily allowance. I was astonished that niacin and ascorbate, vitamin C, with the striking physiological property, when given in very small amounts, of preventing death from pellagra and scurvy, should be so lacking in toxicity that 1,000 times the effective daily intake could be taken by a person without harm. This meant that these substances were quite different from drugs, which are usually given to patients in amounts not much smaller than the lethal dosages." To conclude, as schizophrenia can be a very serious illness, and as this information is for research purposes only, make sure to consult a medical doctor before making any change in medication or supplementation.